Okay, we are going to show you how to bandage a wound when a patient comes into the office. So now we'll say that our patient here came in with a laceration on her forearm. So the first thing that I want to do is make sure that I select personal protective equipment. The appropriate equipment in this case would be a pair of gloves before I work on my patient. So what I'm going to do is I'm going to take some material for her bleeding arm, and I'm going to go ahead and put some direct pressure on there. So if we have an active open wound, the best treatment to get started is direct pressure. And I want to leave that direct pressure on the patient's wound until I get the bleeding under control. Sometimes this might just be a minute, sometimes it might be 10 minutes. So I want to put a good amount of pressure on there so that the clotting process can begin and forms. So I'm going to hold that on there for, like I said, depending upon the size, shape, depth of the wound, we're going to check and see. So I'm going to look and see. Oh, my bleeding does look like it's under control. So what I'm going to do is I'm going to get ready then a bandage to put on my patient's arm. So I'm going to get a sterile bandage, remove it. Again, check again, everything looks good. So what I'm going to do is put this on my patient's arm. Okay, and now I need to I have the dressing. The dressing is what goes directly on a wound. A dressing is sterile, it's absorbent, and it's non-stick. Those are things that go directly on the wound. So this is a non-stick pad. It's sterile, I just took it out of its container, and it's what's going to go directly on the patient's wound. So now the bandage is what holds the dressing in place. So this roller gauze is going to be the bandage. So I'm going to put that around. I'm going to have you lift your arm if you would. Perfect, thank you. And you always want to make sure that you're an inch around the bandage to make sure that it's held in place properly. Okay, so I got that part nice and secure. Is it feeling okay? Is it too tight?
It's fine.
Okay, if it's too tight, let me know. And then I'm gonna go above the wound where my dressing is, at least an inch as well. If I have excess roller gauze, I can always cut that off. But in this case, I had just the right amount. So I'm going to take my tape to secure it. If I can find the end of it. Are your fingers still feeling okay?
Yes.
Not too tight? Perfect. All right. So I can see that there's no bleeding through my bandage or my dressing. I'm going to check my patient for circulation. You can wiggle your fingers. They feel okay? All right, everything's feeling good? All right, I'm going to come back and check you in a few more minutes, okay? So in the meantime, what I'm going to do is I'm going to go ahead and do my documentation. In this case, I have my patient's name and date of birth, the date, time, and then the patient had a 2-inch laceration on her left forearm. Direct pressure was applied until bleeding was controlled. Then a dry, sterile dressing was applied to the wound. The patient was given wound care tips. All questions were answered. That's what I'm going to put in my patient's chart, okay? So I do need to give my patient some care tips as well. And in this case, these are some wound care tips from our office. All right, so here's some instructions for you. It kind of tells you when to take your bandage off, how to clean it, and when you should come back to the office, okay? Do you have any questions?
No, I don't.
All right, if anything comes up or you have any questions down the line, you can give our office a call. The phone number is there at the bottom, okay?
Thank you.
All right, thank you.